So my name is Michelle Joanisse. I'm actually not a doctor. I'm a madame. I'm from Canada. I've been working with DNDi for 2 years as their head of fundraising. Before that, I worked for 7 years at McGill University in Montreal, Canada, with the Faculty of Medicine, raising private money for the faculty. We were raising money for research for our students. Worked with our research-intensive campuses. We were working with our hospitals and so on and raising important money. Before that, I worked for 8 years with Médecins Sans Frontières, Doctors Without Borders, developing their whole fundraising program in Canada. So that's a little bit of my background. So I've spent a lot of time raising private money, and this is what I wanted to talk a little bit about today, raising private money for R&D, for research. So how many of you in the room are actually here to give money? Mike? Come on. Yeah? Okay, so there's 2, 3? Yes, sorry. Okay, it's 3. How many of you, 4, thank you. How many of you are here to raise money? Okay, so I'm going to tailor a little bit my presentation on how to raise money from the 4 people in this room. I'm just joking, Julie. Just joking, Julie. No, but I'll share a little bit of some of my observations in R&D fundraising. So what Julie and Neeraj presented today was on, this morning, was on securing money for MDA programs. So these are treatments that already exist. We want to implement them. We're trying to mobilize this multi-sectorial group of people to collaborate and bring the treatments to the patients. So we're actually at DNDi trying to raise the money to support R&D from scratch all the way to the patient's hand. So bring it from a new compound, so a new chemical compound, all the way to the patient's mouth, if you wish. So Julie presented a lot of statistics. I'm going to just keep mine very simple. The topic of our presentation today is on trends in philanthropy for NTDs. I don't see a trend for R&D. It's pretty flat. There has been no real increase in giving in our field. Roughly right now, if you're familiar with Policy Cures, which puts out a report every year, which I invite you to read, it's excellent. We participate in it. Last year and this year, about $3 billion was given to our field. For DNDi, which focuses mostly on kinetoplastid diseases, that's Chagas, leishmaniasis, and sleeping sickness, those are our 3 major ones. We have others. We receive, that pool of money out of that $3 billion is $131 million. That's directed towards our field. And that's private and public. So it's very small. So this is what I have to fight for, try to get a little bit of that piece of that pie to support our R&D, and I'm sure it's the same in your field. That number has not grown. When I look at statistics in Canada and in the US, and I'm sorry, I'm new to Europe, so I'll get those statistics eventually, there's been a huge increase in philanthropic private giving. So for example, in Canada, 30 years ago, there was about $1.8 billion that was given annually to the charitable sector. Today, it's $8.3 billion. So you've seen a rise. In our field, it's flat. Sure, there's general interest in global health. We're seeing worldwide lots of institutes being created. We're seeing some at Duke, Singapore, McGill, where I worked, University of Toronto. There's many of them in Europe as well. So they're springing up. So there's definitely a keen interest in our field of global health. But in R&D for NTDs, we have to work hard at it. So that's kind of a little bit the landscape that I wanted to start off with. Then I kind of wanted to give you my DNDi experience over the last 2 years and blend that in with my work at McGill University and at MSF. I'll be honest, in our field, I mentioned that we have about $130 million that's kind of available for us to secure on an annual basis. 73% of that comes from public sources. And the rest, so 27%, comes from private sources. DNDi, before I joined, decided that they set up a policy where 50% of the money will come from private sources and 50% from public sources. So as you can imagine, this is going to be my challenge, to try to get private money to come in. Government, it's working out quite well. We've got a handful of donors that are giving to us, DFID, USAID that's finally stepped up to the plate. We've got the Dutch government, the German government. That's all going very well. In fact, we're raising quite a lot of money from them. Private sector is a whole other game. Thankfully, DNDi was founded by Médecins Sans Frontières, which was one of the instigators. And not only are they a founding member, they're also partnering with us in helping us with some of our clinical trials that we're running in the field for some of our work. So not only are they a founding partner, they're operational with us, and they also give us money. We also have the Gates Foundation that's very, very generous, and also Mike, the Wellcome Trust. We have a few other handful of donors, private foundations, but honestly, when I look at my list, it's no longer than about 10 private donors that give to us. Right now, the organization set a business plan, which will take us till 2018. And in that business plan, we have to raise 400 million euros. At this point in time, today, we're at 295 million euros, which is fantastic. We're almost out of balance. We've secured about 124 million in private money, and the remainder in public money. So I still have a bit of room I have a lot to raise. As I mentioned, we have this policy where we want 50% of our money come from private sources. We're at 124, so I have to go and get 76 million euros by 2018. So that's what I have to do, heavens. So how am I gonna get there? Well, I put in place a global team because I did notice some trends. So we have a team of fundraisers. We have 2 staff in New York. We have 2 staff in Brazil. And there's me and another girl in Geneva to cover private fundraising. So there's about 6 of us, roughly. Strong candidates, fantastic experience. We're troopers. But there's 6 of us, and our goal is to raise 75 million. We decided to establish a fundraising program that focuses on major gifts. So these are donors that have the capacity to make a gift of 10,000 and above. Ideally, 100,000 and above would be much better. But sometimes you've got to start with a smaller gift to get to a larger gift. Get the donor to experience the organization before you can actually have a meaningful conversation about a transformative gift. So each of the fundraisers have a pool of people that they're working with. In our Brazilian office, they actually cover all of Latin America, which is a pretty big territory. But the reality is that we might be working with about 5 families. That's it. And we just continue to build a strong relationship. In New York, we're building that market. Although we've been present in that country for a long time, we haven't had a stable group of fundraisers until now recently, so it's great. I would say in terms of our budget, most of our money is spent on salaries for the type of fundraising that we do. So if you're planning a similar type of program of major gifts, you want about 85% of your money to be for salaries and about 15% of your monies to support travel, all these kind of little expenditures that are related to meeting donors. So some of the trends that I've noticed and where I'm heading, there's one trend that's really hard for us. Oops, sorry, never mind. Those aren't my slides. One is in private fundraising, as well as in public a little bit, is the fact that a lot of donors want to earmark their contribution, which is very difficult. So what I tend to do, and this is what I did with the university and also with Médecins Sans Frontières before, is I try to be as transparent as possible to explain to the donor, this is where your money is going. And I'm not just verbalizing it, but we get our accountants, our auditors in. We invite them to come and visit some of our projects so that they can see firsthand what a clinical trial looks like in the Democratic Republic of Congo. Just the logistics of getting to the trial site is an experience in themselves. So we make a huge effort in putting together an annual report that is extremely transparent. So for example, if the Gates Foundation, who's been extremely supportive, wants to know precisely how their contribution has been used, it's extremely detailed. So they can have, and when I say detail, they know how much we've spent on staff, how much we've spent on actually the treatment, how much we've spent on overhead. So all of it is extremely detailed. So this is one way of moving from earmarked funding to unrestricted funding, which is what we really, really need in R&D. Because as you know, scientists and I'm sure some of you are scientists here. Let's just say you've got this brilliant idea, you'd like to execute on it. If you don't have the money, it's not possible, which then delays the process of perhaps finding a better treatment. So having that flexibility and being able to move money from one project to the next is extremely helpful for us in reaching our target. So that's one trend that I'm noticing in terms of earmarked money and unrestricted money. We're faced with this reality. It's very difficult. It requires a lot of effort on our part, but it is possible. It just means that you have to organize the information that you generate from all the money that you've raised and spent so that it can be presented to the donor. There's also a responsibility on the donor's part to also get involved in our organizations so that they're not just, far away, not involved and so on. Once a year they get a proposal or maybe a report, but that you actually have regular conversations with them to explain what is happening. Why are we struggling in certain parts of the Democratic Republic of Congo? Oh, well, there's civil unrest in that area, so therefore we've had to close that clinical trial site. We're behind on the recruitment for our patients. Another trend that I'm noticing, and Niraj, you mentioned that a little bit, and we're going to have a presentation later on this afternoon, is on these new funding mechanisms, these impact bonds. So this is something else that I'm following. Now, in our field of R&D, it exists a little bit. Some university professors have put their bright ideas on these platforms to try to secure monies. But at the end of the day, what I'm noticing is that we fundraisers still have to do the bulk of the work, meaning we have to, do the marketing just like we would for any other fundraising tool that we would use, whether it's telemarketing, direct mail, or emails that we send out. You have to build your network to try to draw them to these platforms to give. So it's a new technology so that's crowd fundraising, but there's also, even the venture philanthropy. You have to build a relationship with the venture philanthropists. You still have to encourage them to be interested in NTD R&D, which is still a challenge. Same thing with the impact bonds. You still have to, explain why NTDs is so important and especially R&D. The other trend that I'm following, I mentioned that we have an office in Brazil. We're also going to be looking into India, and one of your slides showed that India is one of the other areas what may be very interesting to explore. Especially some of our diseases are actually, they actually exist in India, so we're hoping that this might be our next area where we can get private fundraising. So I've overextended my time up here, but those were some of the 3 trends that I'm going to be following. But again, I'd love to talk a little bit more about it. I also have my colleague from our New York office here with us. His name is Richard. So if you have questions for either Richard or and me, we'd be happy to talk about private fundraising for NTDs. A challenge ahead for all of us. Thank you.